What is sleeve gastrectomy surgery and how is it done?
Tüp mide ameliyatı
Sleeve gastrectomy is one of the obesity surgeries and is the most common type of obesity surgery performed worldwide. With minimally invasive surgery, that is with the laparoscopic method, 4 or 5 small incisions are used to enter the abdomen with special instruments, and 70 or 80% of the stomach is removed. Is sleeve gastrectomy surgery the most reliable among obesity surgeries?
Çünkü çok daha
Yes,
sadece
because you're
mideyle
performing a
işlem
stomach-only
uyguluyorsunuz.
operation.
İnce bağırsaklar
You don't
veya
perform
diğer
any operation
karın
with
içi
the small
organlarla herhangi bir
intestines
işlem
or other
yapmıyorsunuz.
intra-abdominal
Herhangi bir
organs.
anastomoz
You don't
dediğimiz
create any way
bağırsakla
that
mide
we call
arasında bir yol
anastomosis
oluşturmuyorsunuz.
between the
Sadece
intestine and the stomach.
mideyle
It is
midenin
only the
kesilmesi
operation
ve
of cutting and
küçültülmesi
reducing
ameliyatıdır.
stomach. What is gastric bypass and how is it done?
Gastric bypass da obezite
Gastric
cerrahisi
bypass
ya
is
da
a type of surgery of bariatric
metabolik
surgery
cerrahinin
or metabolic
başka
surgery.
çeşit
It also
ameliyatlarındandır.
has several types.
Bunların da
They
tabii
have
birkaç
different
tipi var.
names
Aslında
depending on the
bypass,
length of
mide
intestine
bypassları
you use
şeklinde geçer.
and how much of the stomach you
Kullandığınız
cut.
bağırsağın uzunluğuna bağlı
The most
olarak
commonly
midenin
applied type is
ne
the
kadar
type of
kısmını
surgery
kestiğinize bağlı
we
olarak
call
değişen
Roux and
farklı
Y.
isimleri var tabii ki. En sık uygulanan
Here,
bunlarda da
unlike
gastric,
sleeve
Roux and Y
gastrectomy,
gastric bypass dediğimiz bir
gastric
ameliyat
bypass
çeşididir.
is both a
Burada,
restrictive and
tüp
absorption
mide
regulating
ameliyatından, yani
surgery.
sleeve gastrectomy'den farklı olarak hem kısıtlayıcı
We
hem
cut and
emilim
reduce the stomach,
düzenleyici bir
we
ameliyattır.
reduce its volume. At the same
Yani
time,
mideyi
you bring the
kesiyorsunuz,
small intestine
küçültüyorsunuz,
close to
hacmini
the large
azaltmış
intestine and
oluyorsunuz. Aynı
combine it
zamanda da
with the stomach.
ince bağırsağın kalın bağırsağa yakın bir yerinden getirip
Therefore,
mideyle
by providing less
birleştiriyorsunuz ve dolayısıyla
absorption from the
daha
things
az
you
yediğiniz
eat less,
şeylerden
we
daha
enable
az
you
emilim
to
sağlanmasını
lose
da
weight in two
sağlayarak
ways.
hastaya iki yönden kilo vermesini sağlıyorsunuz.
Which obesity surgery is more suitable for whom and how is it decided?
Obezite cerrahisinde ve
We
metabolik
usually decide
cerrahide hangi
together with our
yöntemi
patients
uygulamamız
which
gerektiğini
method we
genellikle
should apply in
hastalarımızla
obesity
birlikte
surgery
konuşarak
or metabolic
beraber karar
surgery.
veriyoruz. Burada tabii belli
Of course,
tıbbi
we also have
kriterlerimiz de var.
certain medical criteria.
Genellikle tüp mide ameliyatları bu
In
obez
general,
hastaların
sleeve
büyük bir kısmı
gastrectomy
için
surgery
uygun yöntem
is the
oluyor. Fakat
suitable
bazı
method
durumlarda
for the
biz
majority of
gastric
obese
bypass
patients.
ameliyatlarından bir tanesinin
But in some
yapılmasının
cases,
daha
we may
uygun olduğuna
decide
karar
that one of the
verebiliriz.
gastric
Nedir bunlar?
bypass surgeries
Eğer
is
büyük
more
bir mide
suitable.
fıtığı varsa hastanın, ciddi bir
If the
reflüsü
patient
söz
has a
konusuysa,
large gastric
metabolik
hernia,
problemler
a
çok
serious
ön plandaysa,
reflux,
örneğin
metabolic
kontrol
problems are
edilemez
at
bir
the
tip 2
forefront.
diyabet söz
For
konusuysa,
example, if there is an
hipertansiyon
uncontrollable
çok
type
kontrol
2 diabetes,
edilemez bir durumdaysa,
if the
bu durumda da
hypertension is uncontrollable,
hastalarımıza
we can recommend gastric
bypass'ın
bypass to
daha
our
uygun
patients.
olabileceğini tavsiye edebiliriz.
Here,
Dolayısıyla
the
burada
patient's weight,
hastanın
body mass
kilosu,
index,
vücut
comorbidities
kütle
help us
indeksi,
to make
ek
this
hastalıkları
decision.
bu kararı vermemizde bize yardımcı oluyor.
How much weight is required to have obesity surgery?
Ameliyat olmak için
For
aslında
surgery,
kilodan ziyade
we look
biz
at the
boy kilo
height to
oranına
weight
bakıyoruz.
ratio rather than weight.
Kilo
We
bölü
calculate
metrekare
weight,
cinsinden boy
height, square
hesabı
meters.
yapıyoruz. Buna vücut
We
kitle
call this
indeksi
the body
diyoruz ve
mass
bu
index.
vücut kitle
Based on this
indeksinde,
value,
elde
we
ettiğimiz
decide
değere
whether the
göre,
patient is suitable for
hastanın
surgery.
ameliyat için uygun
Of
olup
course, we
olmadığına
don't
karar
just make
veriyoruz.
a decision.
Bunu,
The World
aslında
Health
sadece biz karar
Organization
vermiyoruz.
and the
Dünya
health
Sağlık
system of
Örgütü,
our own
kendi
country, the
ülkemizin
health
sağlık
system in
sistemi,
Europe,
Avrupa'daki
we all
sağlık
act
sistemi,
according this guideline.
hepimiz
So
bu
our
kılavuza
measure is
göre
body
hareket
mass
ediyoruz.
index. If a
Dolayısıyla
90 kilo
biz
person
bu
of same weight
çıkan vücut
is
kitle indeksine
155
bakıyoruz. Aynı
centimeter
kilodaki 90
tall,
kiloluk
his
bir
body mass index
örnek
is
verelim.
higher,
90 kiloluk bir
so he
kişi
may
eğer
be
1.55
suitable for
boyundaysa
surgery.
vücut kitle indeksi daha
But a
yüksektir.
90
Dolayısıyla
kilo,
ameliyata uygun olabilir.
170
Ama 90
centimeter
kilo
tall person
1.70 boyundaki
may
bir
not
insan
be
ameliyat için
suitable
uygun
for
olmayabilir.
surgery. If there are additional diseases, how is the decision of surgery taken?
Dünya Sağlık Örgütü'ne göre
According
vücut
to the
kitle
World
indeksi
Health
20 ile 25
Organization,
arasında olan
people
insanlar
with a
normal
body
kilolu
mass
olarak
index
kabul ediliyor.
of 20 or
25 ile 30
25
arasında
are
olduğunda
considered normal
fazla
weight.
kilolu olarak kabul ediliyor.
Between
Ama 30'un üstüne
25 and
geçtiğimiz
30
zaman
is
artık
considered
obezite
overweight.
başlamış oluyor.
But
30 ile 35 arası
when we
birinci
go
derece
over 30,
obezitedir ve
obesity
burada
begins.
ameliyat dışı diğer yöntemlerle
Between
de bu
30 and
kilonun
35
verilmesine
is
çalışılmak
first
için
degree
hala bir
obesity,
zamanımız vardır.
and
Ancak
here we still
35'in
have
üstüne
time
çıktığı
to
zaman
lose weight
hele
by
özellikle
other
obeziteye
non-surgical
bağlı
methods. But
metabolik bir
when
durum
we go
ortaya çıktıysa,
above
örneğin bir
35, especially
insülin direnci
if an
veya
obesity-related
hipertansiyon
metabolic
veya
condition
uyku
has
apnesi,
arisen,
veya
for
hiperlipidemi
example,
gibi
an
ek
insulin
bir
resistance,
durum ortaya çıktıysa, bu
hypertension,
durumda Dünya
sleep
Sağlık
apnea,
Örgütü de, yerel
or
sağlık örgütleri de, Avrupa
hyperlipidemia,
Sağlık
if an
Örgütleri
additional
de
discomfort
bir
has
ameliyatın
occurred.
çok daha
The
faydalı
World
olacağını
Health
öneriyorlar.
Organization,
35
local
ile 40
health
arasında olan
organizations, and European health organizations
kilolu
also
hastalar,
state that an
vücut
operation
kitle indeksi
will be
35'in
more
üstünde olan,
beneficial.
bu hastalar
Overweight patients
ikinci
with a
derece
body
obezite
mass
olarak
index of
yorumlanıyor. Fakat
35
bu iş
or
40'ın üstüne
40
çıktığı
are
zaman,
interpreted
vücut kitle
as
indeksi
second
40'ın
degree
üstünde
obesity.
olanlar ise
Those with a body
morbid
mass
obezite
index over
olarak
40
adlandırılıyor.
are called
Morbidin
morbid
kelime
obesity.
anlamı ölümcül
In other
demektir.
words,
Yani
it means
ölüme
being
sebebiyet
overweight
verecek, ölümü
enough to cause diseases that will
tetikleyecek
cause that and
hastalıklara
trigger
sebep olan
that.
kilo fazlalığı
And in
demek
those
oluyor ve
over
bu
40,
40'ın üstünde
the
olanlarda
criteria
artık
for the
ek bir
onset of
hastalığın
an
başlamış
additional
olması
diseases
kriteri
are not
aranmıyor.
sought.
Bunlara
It is
mutlaka
accepted
ameliyatın
by the
yapılması
World Health
çok
Organization
daha
that
faydalı
surgery will be
olacağı
much more beneficial
Dünya
for
Sağlık
these
Örgütü
people.
tarafından kabul ediliyor.
Should patients be afraid of bariatric surgery?
Hepimiz bir
We all
ameliyat söz
hesitate
konusu
for a
olduğunda, bu
while
küçük olsun,
when it
büyük
comes to
olsun,
an
ne olursa
operation,
olsun, biz
minor or
de
major surgery,
olsak bir
even
müddet
us.
tereddüt ederiz. Bunun
For
için
this,
ameliyat
we do
olmalı
some
mıyım,
research on
olmamalıyım
whether
mıyım
I should
konusunda
have surgery
biraz
or
biz de
not,
araştırırız, biz de
and we
kendi
ask
kendimize
ourselves
sorular
questions.
sorarız. Ancak
Most of our
çoğu
patients
hastamız da
definitely
buraya
made such a
geldiğinde
decision
mutlaka daha
when they
önce
came
böyle bir
here,
karar vermiştir,
but they
korktuğundan
postponed it a
sebep
little
biraz
because
ertelemiştir.
they
Fakat
were afraid.
ameliyatı
But this is
olanların
what
hemen hemen
100% of
%100'ünün
those
söylediği şey,
who had the
keşke bundan
surgery
önce olsaydı
said,
şeklinde
I
oluyor.
wish I had
Sonuç
done this
olarak bir
before.
ameliyat oluyorsunuz,
As a
belirli
result,
riskler alıyorsunuz
you
ama
have an
hayatta
operation.
hiçbir şey
You
risk
take a certain
almadan
risk,
bir
but
şey
nothing in
kazandırmıyor
life
size.
gives you anything
Fakat
without
dünya
taking risk.
çapında
However,
bir
in studies
yapılan
conducted
çalışmalarda
around the world, the
ortaya
following emerged.
çıkmış.
When we sought an
Bu
answer to
şekilde
the
kalmak, yani
question,
morbid obez
is it
olarak
more
hayata
risky
devam
to
etmek mi daha
continue life as
risklidir,
morbidly
ameliyat mı
obese,
daha
or
risklidir
is
şeklinde
it
bir
more risky
soruya
to have
cevap
surgery?
aradığımızda
It was
morbid obez
revealed
olarak hayata
that
devam etmenin çok
continuing
daha riskli
life
olduğu
as
ortaya
morbidly obese is
konulmuş.
much more risky. What are the diseases caused by obesity?
Morbid obezite,
Morbid
birçok hastalığı
obesity is a
tetikleyen bir
disease that triggers many
hastalıktır.
diseases.
Aslında bunu artık
It
kilo
is
fazlalığı
accepted
olarak
all
değil,
over the
hastalık
world
olduğunu,
that is no
bütün
longer
dünya,
called
genelinde
overweight
kabul
but a
ediyoruz.
disease. We know that obesity
Tabii ki
triggers
birçok
many
hastalığı,
diseases
yani
such as
bilinen
insulin
şeyler,
resistance,
işte insülin
type 2
direnci, daha sonra
diabetes,
şeker, tip 2 diyabet,
hypertension, sleep apnea,
hipertansiyon,
high blood
uyku
fat,
apnesi,
hyperlipidemia,
yağlarının
and joint
yüksekliği,
disorders.
hiperlipidemi
We
gibi
also know
ve
that
eklem hastalıkları
obesity
gibi
is
birçok
effective
hastalığı tetiklediğini
in some
biliyoruz ama
types
aynı
of
zamanda
cancer.
bazı kanser
For
türlerinde
example,
de
it is known
obezitenin
that
etkili
obesity
olduğunu
is
biliyoruz.
effective
Örneğin
in
meme
types
kanseri gibi,
such as breast
yumurtalık
cancer
kanseri gibi
and
bunlardan
ovarian
kesin
cancer.
olarak
Obesity is not just a
obezitenin
fat
etkili olduğunu
we see
biliyoruz.
from the outside.
Sadece dışarıdan
At the
gördüğümüz
same
yağlanma
time,
değildir
it
obezite.
should be
Aynı
considered as the
zamanda
lubrication of all
bütün
organs.
organların yağlanması
That's
olarak
why
kabul
we call
etmek
it a
lazım. O
metabolic
yüzden
disease.
metabolik bir hastalık
You have
olarak
lubrication
nitelendiriyoruz.
under the skin.
Yani sizin
You see it
cilt
from the
altınızda bir
outside,
yağlanma oluyor.
you
Siz bunu
realize
dışarıdan
it,
görüyorsunuz, sadece
but
bunu
in
fark
fact, in
ediyorsunuz ama
patients who come to
aslında
us,
bize gelen
we see the damage
kişilerde
it
biz
causes to the
bundan
organs
ziyade
in the
karın
abdomen
içerisindeki
rather than
organlara
that.
verdiği
The
tahribatı
most
görüyoruz.
fundamental reason
Ameliyat
for
ediyorsak da
surgery
aslında
is
birinci
actually this
sebebimiz bu
organ
oluyor.
damage. If you have an accumulation
Eğer
of
cilt
fat
altınızda
under the
bir
skin,
yağ birikmesi
it
varsa bu
also
aynı
causes an
zamanda
accumulation in
kalp
your heart
damarlarınıza da bir
vessels.
birikime
It
sebep olur.
causes fat in
Karaciğerinize
your
de
liver,
yağlanmaya sebep
and
olur
we
ve
need to
diğer
know
bütün
that
organlarda
this
da
fat is
bu
also
yağlanmanın
present in
olduğunu
all other organs.
bilmeniz gerekir.
Therefore, if we
Dolayısıyla
are
eğer bir
making an
ameliyat
operation
kararı
decision,
veriyorsak,
our main
asıl
goal
bizim
is to
hedefimiz bunları
reverse
geriye
them.
döndürmektir.
Can we get rid of type 2 diabetes, sleep apnea, and hypertension with sleeve gastrectomy surgery?
Obezite ve metabolik
Surgery performed within the scope of obesity and metabolic surgery largely reverses the metabolic effects of obesity. Most of our patients come to us after they have stopped almost all of the 5 or 6 drugs they used before the operation after the third month after the operation. Because your sugar is definitely regulated. Sleep apnea is very serious condition. Many people are forced to sleep with the device. This device may not be needed after the surgery. They either use the drugs used for hypertension at a very low level or stop them completely. Therefore, we see the great benefits of obesity surgeries in terms of many effects. How does the process before and after sleeve gastrectomy work?
Hastamızla ilk
In our first meeting with our patient, We talk about his expectations, our expectations, and which method will be appropriate for the surgery. It has to be thought of as a process. This process includes not only the day of surgery or the 2 days spent in the hospital, but also a period of time that the patient will spend at home. If there is no exercise in his life, we are talking about that he should do this exercise now, that we have a certain diet program, and that he should follow these rules. People who are ready for this have a much more comfortable process. As in every surgery, tests related to obesity surgery need to be done. But we do a little more detailed examination in our patients who will have obesity and metabolic surgery. For example, if there is a weight gain due to a hormonal problem, we need to determine this beforehand. So we want some hormone tests. We usually do an endoscopy to see if there is any problem in the stomach that will hinder us, delay the surgery, or change the way of surgery. Apart from that, we would like to see if there is any different situation in the abdominal organs, whether there is a situation that needs to be intervened, or if there is a situation that will change the type of surgery, or cause the surgery to be postponed. We walk the patient 5 or 6 hours after the surgery. What we want most during this operation is to walk as soon as possible. We are trying to prevent accumulation of blood in the veins, so we definitely get the patient up after 5 or 6 hours. There is no eating or drinking on the first day. We feed it with serum. The next day, after taking tests to check our stitches, we slowly start with a soup-style watery diet. On the second day, we usually discharge our patient in good health. How is gastric leak test done after surgery? We do the first leak test during the operation. At the end of the operation, we inject a blue dye through a tube that we place in the stomach of the patient. We observe whether this blue dye escapes from the seams. If there is a problem, we intervene immediately. On the first post-operative day, we perform the leak test by using this blue dye, or by taking a tomography or X-ray by containing a contrast liquid to the patient. When can we travel after discharge? Most of our patients come from outside the city or abroad. One of our patients, who is discharged from here after 2 days, can easily go to his country by getting on the plane on the same day. This doesn't cause any problems. Being out of the hospital means that he can go home, fly and travel with peace of mind. For our patients coming from abroad, we make our program accordingly. We determine our surgery appointment beforehand. We make our surgery preparations before our patient arrives. Thus, we can keep the time to be spent in the hospital before the surgery as short as possible. Will we get support from a dietitian after the surgery? During the operative preparation process, our dietitian sees the patient. Preliminary information is given about the issues to be done before and after the operation. As doctors, we always talk about this when meeting with patients, because you are creating a new stomach. This new stomach has a small volume of approximately between 150 and 180 milliliters. We explain the rules to our patient in this new process. The first month of the recovery process is very important for us. First month must be passed without any problems. Our patient, who was discharged on the second day, is recovering, but the stitches in the stomach should not be forced. He needs to take a liquid food for the first 15 days. Our dietitian explains in detail which foods the patient can consume consume. The second 15-day period is the MASH period. Food in the form of baby food should be consumed. Then, we gradually switch to solid foods. But while taking solid food, it is necessary to eat healthier foods rather than foods with plenty of calories. All of these are written in the booklets we give to our patients after surgery. It is also controlled by our dietitian. Dietitian control should be continued at regular intervals. We talk to our patients over and over again at the first month, third month, and sixth month, and 12th month. In this way, we follow our patient. Will there be a weight gain after obesity surgeries? Weight gain is possible after a certain period of time, after both sleeve gastrectomy and bypass surgery. We shrink the stomach and reduce it to a certain volume. But the stomach is an elastic organ and has the ability to expand up to a certain stage. We definitely talk about this situation with our patients before the surgery. With these surgeries, we actually provide the patient with the following. We provide less eating that he cannot do with his own will. And we eliminate the feeling of hunger because we remove a certain part of the stomach. In 3 or 4 years, the stomach actually stops in such a way that its volume doesn't expand too much. During this process, the patient cannot eat much, even if he wants to. Therefore, he continues to lose weight. At the end of 4 years, there is a slight enlargement of the stomach, but the real weight gain isn't the enlargement of the stomach, but the patient's return to his old habits. This is the biggest danger here. Therefore, we suggest the following. You have embarked on a path, you are undergoing an operation. This operation may have been something you were afraid of, but you dared to do it, and you had the operation. This offers you a great opportunity. You both eat less, and you feel full with this surgery. You have to act accordingly for the rest of your life. Because when it comes to obesity, some things have definitely been done wrong in the past. Either you ate too much, or you spent less, or you have a habit of snacking, or you have a habit of consuming high-calorie foods, or you have a habit of eating at night. You must have one or more of these habits. That's why you have obesity. Therefore, after this surgery, we provide a few years to avoid these habits, but it is in the hands of the patients to maintain them. What is revision surgery? Can a patient have a second surgery? In our patients with sleeve gastrectomy and patients with gastric bypass, if there is a weight gain, and this does not change with diet or by rearranging their life habits, then revision surgeries are in question. According to the first surgery, there are several types of revision surgery. If the patient had a sleeve gastrectomy in the first operation, revision surgery can be easily performed. Because we didn't use the small intestine there before, now we have a chance to use it. However, if the first operation is gastric bypass, it may be a little more difficult to perform revision surgery, since we have already used this option. In summary, we have several alternatives for revision. We can either convert sleeve gastrectomy to mini gastric bypass, or we can convert it to gastric bypass. If the stomach is overly enlarged, we can do this in the form of a re-sleeve or a second sleeve. Is there any pain after gastric sleeve surgery? As a result, when you have an operation, there is more or less pain. However, these surgeries are what we call minimally invasive surgery, that is, those performed with very small incisions. Therefore, post-operative pain usually doesn't go away after the first 1 or 2 hours. In the first 1 or 2 hours, there is a slight pain, not intense. You do the same surgery on 5 people, you get a different response in all of them. But generally, 90% of our patients describe the pain in the first 1 or 2 hours as mild. Again, nausea in the first 1 or 2 hours after surgery is natural, but it is also mild. Other than this, there are no very disturbing situations. After 4 or 5 hours, our patients can easily get up and walk. How long does gastric sleeve surgery take? Although the weight and condition of the patient are also effective, the operation time is usually around 45 minutes. The time between the start and the end of the surgery is 45 minutes, but the patients have a preparation period. After entering the operating room, there is a preparation period for anesthesia first. Then, since these operations are performed with laparoscopic instruments and devices, they have a preparation. A certain amount of time is required for the patient to be fixed on the table. After we start and finish the surgery, there is the wake-up phase. After the patient is awakened at the table, if he has any pain or nausea, he is kept there for a certain period of time to relieve them. After that, we go to our room. When can we return to work after the operation? We recommend starting work a little later in physically demanding jobs, but if you work at a normal desk job that doesn't require physical strength, you can start work 2 or 3 days after the surgery. I have many patients who go to work the day after they are discharged. Does the feeling of hunger disappear completely after the operation? In the upper part of the stomach, there are stomach cells where the ghrelin hormone is secreted more frequently. In fact, the hormone ghrelin is a hormone secreted in all parts of the stomach. But the point where it is higher is the upper part of the stomach, near the esophagus. We completely remove that area. Therefore, this process suppresses the feeling of hunger and creates a feeling of satiety. In fact, I think this is one of the biggest reasons for the success of these surgeries, because you don't feel hungry and you lose weight without getting worn out psychologically. In the old surgical methods, for example in gastric banding method, that is in clamp surgeries, we were clamping the stomach with the help of a clamp, turning it into an hourglass. However, since the part containing the ghrelin hormone wasn't removed in these surgeries, you ate less but felt hungry. You vomited when you ate too much. You did not want to eat, but you felt hungry. In new generation surgeries, this doesn't happen at all. Even the patients who are very fond of food, after an adaptation period of 3 or 4 days, even our patients who say that I can't stop eating and that they always eat something at night, say, I don't look for food at all. I don't want to eat whatever is in front of me. I'm satisfied with what I eat and I spend the process very comfortably. Therefore, it is very important to eliminate the ghrelin hormone in these surgeries. Is there an age limit for sleeve gastrectomy surgery? Actually, there is an age limit. The more acceptable age ranges between 18 and 65 years old. The World Health Organization suggests this. But there is another situation. It can be performed under the age of 18 or over the age of 65 if there is a definite indication, both in terms of surgical performance and indication for surgery. Does obesity surgery make it easier to get pregnant? We know that many metabolic diseases increase with obesity. One of them is polycystic ovary syndrome. Polycystic ovary is one of the biggest causes of infertility in women. There is a hormonal imbalance. 3 months after sleeve gastrectomy, all of these hormones begin to balance. After 6 or 7 months of weight loss, these hormones become so regular that women can get pregnant without the need for any IVF treatment or hormone replacement therapy. In summary, these surgeries definitely increase the probability of getting pregnant. How do patients return to their doctors months after the operation? We have very happy conversations with our patients. Obesity is not only a physical excess weight, but also a condition that will cause psychological distress and depression, but also a metabolic condition. We can see the improvement in our patients from the blood tests, but the real improvement is the psychology of our patient. For example, you're a young and overweight person. You go to a store. You don't get what you want. I understand how important even this is in my conversations with my patients. When I first talk to my patients, a person who is usually a little more shy, has less self-confidence, and has a slightly lower body image, completely renews himself 3 months after the surgery. Instead, there are people who talk a lot, always want to tell, and constantly express their self-confidence, which makes me very happy, of course. Will there be any scars on our body after the operation? We use small incisions because we perform the surgery with a minimally invasive method. But no matter how small the incision is, if there is an incision, there will always be a scar. How obvious this scar will be depends entirely on personal wound healing. However, in the vast majority of patients, between 90 and 95% of patients, the scar is only a slight color change that is not obvious at all. Will there be a sagging in our body after the surgery? In our post-operative follow-ups, we say to our patients, we want to lose excess fat. We want our muscles to be protected in the same way. For this reason, we definitely give protein powder supplements to our patients in the early period. After the first month of the operation, we strongly recommend that they protect their muscle mass with exercises. Whether there is sagging or not is related to the pre-operative weight of the person. If you have decided to have this surgery when you are 180 kilos, of course, because the weight you will lose will be too much, there may be a skin sagging. However, if you had this surgery when you were around between 100 and 120 kilos and did the exercises, adjusted your eating habits, took protein foods, there may be only very small, unobtrusive sagging. However, we recommend that people who lose a lot of weight and have sagging skin apply to plastic surgery after 2 years.